Therapy. My name is Rachel. I'm the course director for the BSc programme here at St George's. And I've got another one of my colleagues with me and two of our students, so I'll let them introduce themselves before we get started.
Hi everyone, my name's Caitlin Williams. I'm one of the occupational therapy lecturers at City St George's University. I've been in the team since May. It's really nice to talk to you all.
Hi everyone, my name is Lizzie and I'm a second year occupational therapy student here at St George's.
Hi everyone, I'm Gregoria and I've just completed a degree. I was a student until last August, so lovely to be here with you all.
Great, thank you guys. So I'll start with a presentation a bit about the course, and then we'll hear a little bit from the students, and then there'll be time at the end for everyone to ask some questions. Okay, lovely. So hopefully you can all see that. I think hopefully one of the others will let me know if it's not working. So what I'll run through, thanks Caitlin, what I'll run through in this part of the webinar is a bit about occupational therapy itself, what that is, and as a career. I'll talk a bit more specifically about the BSc programme here at St George's, and a little bit about the entry requirements, if that's something that you're interested in hearing about. So what is occupational therapy? So it really is a career that's centred on people. We sort of often ask if people are kind of creative, problem solvers, and who really enjoy helping people to get the most out of life. So it's really important, I think, to be an OT, that you like working with people, and that you are quite creative and enjoy really thinking outside the box, and problem solving. So that is a really big part of what we do. So what do we mean when we talk about occupations? Because I think the kind of title of occupational therapy can sometimes be confusing for people. So what we mean in occupational therapy as occupations, we refer to these as the everyday activities that people do to occupy their time. So that's where the term occupations comes from. And bring meaning and purpose to life. So when we talk about occupations, it can be absolutely anything that people do in their day to occupy their time. So it's kind of not just the things that people need to do. So that's, getting up in the morning, getting washed, having a shower, eating, but also the things that people want to be able to do and are expected to do. So whether that's, expectations within families, cultures, the work environment. And these include kind of things like self-care, like I mentioned, so showering, eating, kind of being able to get dressed, work or study, education, and of course leisure activities as well. So there's a massive spectrum of things that we consider as occupations, and that we help people to be able to do. So this is the definition that the Royal College of Occupational Therapists, so that's our governing body, and they say that occupational therapy provides practical support. So I think that word practical is really key to who we are and what we do, to enable people to facilitate recovery and overcome any barriers that prevent them from doing the activities, the occupations that matter to them. This helps to increase people's independence and satisfaction in all aspects of life. So yeah, like I said, I think the key words in there is about, this being quite practical. I think we are quite practical people as occupational therapists. And it is about helping people overcome any barriers. So whether somebody's had an injury or an illness, or they've got a long-term condition, it doesn't really matter what the root cause of somebody's difficulties is, but it's about, us trying to get over those barriers and help them to become a bit more independent with what they want to be able to do. We very much take a whole person approach. So that's kind of meaning we encompass both mental and physical health and well-being in order to help people achieve their full potential. So again, I think that's a really nice thing about occupational therapy, or OT as we abbreviate it to, is that we teach all of the students, and that we're all trained to look at mental health and physical health. And we're, what we use this word kind of holistic, this kind of whole person approach when we're working with our clients. So yeah, like I said, it is a very person-centered health profession. We really kind of try and build relationships with the people that we're working with and find out what's important to them in our work. We're very concerned with promoting health and well-being through the use of occupation. So that's a really kind of the core of what OT is that we think about how we can use occupations to help to promote kind of the health and well-being of the people that we work with. We enable people to participate in activities of everyday life. And we work with, people sort of on an individual level, but also on a community level as well. This is a nice quote that we often use, and it just says that occupational therapy practitioners ask what matters to you and not what's the matter with you. So again, that's really core to what we do, and we're maybe less focused on what is actually wrong with people, what illness have they got, what injury have they got. That's, it is important, but it's less of what we focus on. We really focus on actually, what's that stopping you from being able to do, and what would you like to be able to do that you can't do now. So we really want it to be a career for everyone. There's a huge range of people that need support from occupational therapists. We work with people, really across the lifespan, from, small babies in, neonatal units, all the way through the lifespan with people in elderly care, and then, to end of life care as well. And we really want to, therefore, kind of attract people from kind of all walks of life to the profession as well, so that the profession as a whole really reflects the people in the communities that we're working with. So when might someone need an occupational therapist? So I'm assuming, the reason most of you are here is because you'll have heard of OT, and often we find that people who come into OT to study have encountered an OT at some point, or perhaps have worked with an OT, or family member have had an OT. So it can be really anything. So it is really, like I said, when there are problems with everyday routines, or people are struggling with some of those occupations that they want or need to be able to do in their day. And it might be related to an illness, to a disability, either a new disability or a long-term disability, getting older. So as we get older, things get a little bit more difficult sometimes. A change perhaps in personal living circumstances, or barriers that have come up for that person, and a lack of opportunities in their environment. So there's a really wide range of things that we work with, and environments that we work in, and areas that we work in. So that's the next slide. Yeah. So we work in so many different areas. So hospitals is a kind of, very kind of popular area that we work in. So we do work in acute hospitals with people that are sick or have experienced injury. And that could be a physical hospital, but also mental health hospitals as well. So people who are experiencing acute mental health difficulties, or perhaps in a rehab setting. We work in social services, so local authority. We kind of, in those environments, focus a lot on housing, and perhaps making adaptations to people's housing if they need it, issuing equipment, so adaptive equipment to people who need it. Schools and nurseries, we play a really big role in paediatrics, so you'll often find OTs based in schools and nurseries and other kind of paediatric services. Charities, so the photo there is of a Pets as Therapy charity, but we now work, and this is kind of, I guess, coming a little bit more common, and we're broadening our roles out into the third sector. I'm finding that actually lots of charities now are employing OTs to work there. Private practice, so a bit kind of maybe further down your careers, people do end up working a little bit more now in private practice. There's definitely some scope for that. And prisons, that's again quite a new area, definitely an area where we have a really big role, but it's still, I guess, what we call emerging as a role for OT. And that's just, you know, a really small snapshot of the places that we work. There's lots more areas that we work in. So like I said, we work with people of all ages, backgrounds, circumstances, and then we might work on a slightly larger level as well. So with commissioners, with communities, groups, and then of course on an individual level as well, and locally, nationally. So thinking about, you know, things on a more national level, and of course internationally as well. OT is quite well recognised internationally, so you will find that, yeah, there's lots of different networks abroad of OTs who work abroad as well, and you can get involved with that a little bit further down the line. So what do we actually do? So we really focus on identifying kind of skills and strengths and abilities and interests that are important to the person. So we're not, you know, we try not to look at the things people can't do, but actually what can they do? And more importantly, what do they want to be able to do? So we always ask about somebody's roles and their routines. So what do they normally do? And like I said earlier, what they're expected to perform. So, you know, we do have things that we are expected to do, don't we? We do some assessment and identify what needs the person might have. We set goals. That's a big part of what we do. So asking the person what their goals are, what they want to work on, and then plan our treatment. So what are we then going to do about it? And there's a range of interventions that we use. So that very much depends on the setting that you're working with and the age group that you're working with. There's lots and lots of different things that we have in our toolbox to help people to get back to and to be able to participate in their occupations. So why become an OT? So it's really, really rewarding as a career. So we really do help people to engage in the things that are most meaningful to them. We're quite unique in that we're the only profession that specifically uses occupation and those occupations that are important to people as our therapeutic tool. So that's what we're using to do our jobs. Like I said, we work across a diverse range of settings. So if you end up working in a certain area and you think, actually, this isn't for me, I'd like to try something else, you can usually quite easily switch. So that's really nice. You never really get bored. We have a really kind of complex understanding of the importance of occupations on people's health, well-being, and quality of life. And you'll nearly always be able to get a job. There's, as you might have heard, a kind of nationwide shortage of all healthcare jobs at the moment, and OT is on that list of jobs that people do want. So yeah, you will always be able to get a job, certainly at the moment. So a little bit about St. George's. Let me just quickly check the time. Yeah, we're fine. So why come and study at St. George's? So St. George's is, so it's now City St. George's. It will be officially City St. George's from March. So we have merged with City, but we will remain as the Tooting campus. And we are, I guess, the only kind of specialist health university in the UK. So everything at the Tooting campus is all healthcare, it's all medical. We are sited on the same site as a large teaching hospital. So you might have visited for open days already. But if not, you'll see when you kind of immediately walk in to St. George's that it is on the exact same site as St. George's Hospital. So you're kind of waiting for your coffee with kind of healthcare professionals that work in the hospital as well. So you get to really kind of be in that environment and absorb that environment. We are quite proud that we have a really high proportion of students that graduate with good degrees. I think last year it was in the high 80s. I can't quite remember the exact figure now. So that's students that either graduate with a first or a 2-1. And, grades aren't everything with this profession, but that is something that we are quite proud of. And like I said, jobs at the moment are plentiful. So kind of last year, 93% of our students were in work or further study. So whatever they kind of wanted to be able to do, if they wanted to go on and do a master's, or if they wanted to be employed. 93% of people were kind of where they wanted to be within 15 months of finishing the course. And the NSS is the National Student Survey. So this is a survey that all students across the country in every course, every university gets sent after graduation or at the end of the course to fill in a survey about their satisfaction of the course that they've just finished. We always get really high scores, both kind of nationally against kind of other courses, but also we always score really highly in the university as well, compared to some of the other courses. So we're quite proud of that. So some of the, I suppose, benefits of St. George's, maybe in comparison to other occupational therapy programs, we have quite a small student cohort. So the maximum students that we will have is 30. That's probably not going to change in the foreseeable. So there'll be about 30 students. We're very diverse. We're kind of situated in London and in South London. So we do attract a real diversity of students. And, you know, that's not just about kind of race and ethnic background, but age groups as well. We kind of often have quite a wide range of ages. Still quite a lot of females compared to males, but that is getting a little bit better. But yeah, there's always a really nice diversity in our cohorts. We've got a growing team at the moment of experienced teaching staff and clinicians and researchers. So we've all worked clinically before, and we all come from different clinical backgrounds. So we bring that experience into the classroom. We have specially designed teaching rooms for the OT course. We call it the Art of Living Suite. So we've got a simulated kitchen and bathroom and kind of designated equipment and things like that that we can use for teaching. There's lots of kind of on a wider university level, really nice library, lots of study space, computer rooms, access to lots of journals and books. We also really lucky because of kind of where we are with on the same site as St. George's Hospital, we have access to what we call an anatomy suite. So this used to be a dissection lab. It's not used for that anymore, but it is purely used for teaching. So that's really great, and you will get access to that in your first year for teaching. So our programme is accredited by the Health and Care Professions Council, so they have to approve all the courses for OT in the country, as do the Royal College of OT. We're also accredited by the World Federation of OT, so that means it is a little bit easier if you wanted to go and work in another country, that we are recognised and approved by the World Federation. At the end of the 3 years of the BSc programme, you're completely qualified to practice. So there's no extra kind of learning or anything that needs to happen at the end. You are ready to go. And we include 1,000 hours of practice experience in our programme, and that's what's required. So the Royal College of OT require that you have 1,000 hours of kind of being out on practice placement in order for you to qualify. And these are some of our students, some photos that we took a few years ago of various activities that were going on. So what does the course look like? So it's a 3-year full-time programme, split across 3 terms. So September to Christmas, Christmas to Easter, and Easter to summer. There's approximately 16 to 20 hours of teaching per week. So I know you're probably thinking that doesn't look like full time, but we do expect you to do additional work outside of that face-to-face study kind of learning time. So it depends on kind of what term it's in and what year you're in. You might be in 3 days a week, but actually we'll give you probably at least a day or a day and a half's worth of other work that you'll need to do. And we use a combination of lectures. They're not loads of big lectures because obviously, like I said, we're quite a small cohort. More kind of classroom-based learning, small group work, a little bit using technology and virtual learning environments. And like I said, there's 28 weeks, which equates to that 1,000 hours of practice placement over the 3 years. So this won't mean too much to you now, but just a little bit of an overview of what the course actually does look like. So in your first year, there's 4 modules. The ones that are coloured green are ones that what we call interprofessional. So you do those with other students from other courses. So Essentials for Allied Health is done jointly with physiotherapy and diagnostic radiography, and Factors Influencing Professional Practice is just us and the physiotherapy students. And then the two in the middle in that nice beige colour are just occupational therapy modules. And then at the very end of first year, you get to go on your first placement, and that's only 4 weeks. And then in second year, it's just us. So all the modules are done just with the occupational therapy students. There's no interprofessional learning. And then you do 1 9-week placement. And then in third year, you've got 3 modules and 2 placements. So third year is a little bit heavy on the placement. So there's 2 8-week placements that happen in year 3. So some examples, because we often get lots of questions about placement and where people might go. So this is, again, a bit like where we work, is just a really small snapshot. So palliative care is an example, children's services, eating disorders, maybe community learning disability teams, acute trust. So when we say acute trust, we usually mean big hospitals, so physical hospitals, mental health. There is an opportunity in your final year to go on an international placement. And then what we call role emerging placements. So this would be like what I was saying about prisons, and maybe some third sector placements, so with charities. Placements that are kind of establishing new OT services and would like students to come on board. So that's quite exciting. And it's just worth noting that you will have to travel to placements. So that's always something we want to make sure that we make quite clear from the beginning, is that, you know, we do get offered placements all over London, and London's really quite big. So just to be aware that you will have to, you know, travel. You might have to travel to and from placement. And then at St. George's, there's lots and lots of support for students. So there's a free counselling service, which is, you know, excellent. That doesn't happen everywhere. Of course, the programme team, so us, and there's a thing called Study Plus, which is a kind of library service that helps you with your academic skills. So if it's your first time coming to university and you're not kind of sure how to write in a kind of at university level or in an academic way, they'll be able to help you with that. Everyone gets allocated a personal tutor, so that's kind of your point of contact in the course team. There's a really good student life centre, of course, your peers, so other people in your class. We do have an excellent disability team, so, you know, we very much welcome, you know, applications if you've got any, you know, disabilities, learning difficulties, dyslexia, mental health diagnoses, anything. You know, we will see what we can do and make sure that we can support you as best as we can. And there's, you know, lots of welfare support as well. We've got a really active student union. And lots of other services within the student union that are there to support you as well. So very quickly, a little bit about the entry requirements. So the kind of first thing that you need to do is think about the academic requirements. So at GCSE level or equivalent, if you're, you know, didn't do that level of education in this country, we're looking for maths, and English and a science at grade 4 or a C. At A level, it's BBB. And then we do, of course, accept people through other routes, such as access courses, if you've done a previous degree as well, a foundation degree, BTEC. Please do have a look at the website. There's a bit more detailed information on there about those other access routes into the course. And you can always contact our admissions team as well. And if you have any queries, and they'll be able to give you a bit more kind of specific, bespoke advice about that. So once you have looked at the academic requirements, then the non-academic things. So we ask you then, of course, to apply through UCAS, and you've got to write your personal statement and show that you have, you know, commitment to studying occupational therapy, an understanding of kind of what we do and the scope of practice. We'd always recommend you look at what the NHS health and social care values are at the moment, because we often ask about those. And then once you get through that step, then the final step is that we'll invite you to interview. And what we do here, and lots of other universities do the same, is called a multiple mini interview, so an MMI. And that's where you go around, I think there's 5 stations, and you get asked a different question. And they're not about occupational therapy, because we don't expect you to know anything about that right now, but they're based on those key values. So things around dignity, respect, team working, and things like that. So, but once you get to that point, we'll give you lots more information about that. And then once you get through that and you get an offer, you will be asked to do a police check, so DBS, and also a health check. So we have to make sure that all of our students, this applies to everyone who works in healthcare, have, of course, no criminal background, but are also well and healthy enough to be here and to take part in the course. And that is it. So those are the contact details for our admissions tutor. So Sarah, she wasn't able to be here today, and Caitlin, who is with us. So it might be worth taking note of those email addresses if you want to ask any more questions about the course. And like I said, you can always contact our admissions team as well. So those are some references. That is me.
Hiya, so I briefly introduced myself earlier to those who are there, but my name is Lizzie and I am a second year student here currently on the occupational therapy programme. So I am just here to tell you a bit about my experience of being a student here so far. So I'm a mature student, which I couldn't quite believe. I had done a degree in psychology prior to coming here, and then had been working as a course administrator at an educational college for about 6 years. I actually didn't know what occupational therapy was until about a couple of years before applying. I had always loved helping and encouraging people, but hadn't really started considering a healthcare profession until I actually saw a video online of a 17-year-old girl who had had a cheerleading accident and was paralysed, and just seeing how her life changed so dramatically. She was once so independent and athletic, and then suddenly was dependent on her family and friends for everything. I just found watching her journey really inspirational, and seeing how important it was to her for her to find adapted ways of doing activities, such as she loves to do her own makeup. So seeing how she was able to go about that, and how occupational therapists can really provide that practical support. That was what really made me consider that this was actually something I'd really love to do, particularly when they've got barriers that they're facing in any kind. As a mature student, I was a bit nervous that I might be the oldest on the course. I'm 28, but that's not been the case. And it's been really lovely to have, as Rachel said, such a wide range of ages on the course. So we had some school leavers, so some coming in at 18 or 19, but there's also a number of us who've come in from perhaps doing another career, or working as an OT assistant, or having done a previous degree as well. And I was actually already living in southwest London beforehand because of my work. So I have stayed living with a couple of friends there. So it takes me about 45 minutes commute to George's, which is still less than it did for work. So that's always a bonus. But one thing you'll find about studying at George's compared to my first degree, where it was very much a campus-based uni, is a lot of people will commute. So I would say the majority in my year group do commute across a whole wide area in London. But there's also the opportunities to live in halls if that is something that would suit you. Perhaps you're not based in London, or you just want to have that sort of student community. I've had friends in that, and they've really loved that too. One of the things I'd love to say is I really liked St George's because it was a specialist healthcare university when I was looking at it against other courses. This may have been silly, but it made me feel like they knew what they were doing. And the fact that you're surrounded by people who are actually in the profession doing the job right now just felt like a really cool experience. And as Rachel said earlier, having the opportunity to have lectures with other healthcare professional students like physios and diagnostic radiographers I think it's just a really helpful tool preparing us for our work in the future. Something as well that George's I found was really helpful with was when I was thinking of applying or was in the stages of applying, I had some really great chats with some of the people in the department to sort of find out more about the course. And there was also a system called UniBuddy online where I was able to speak with a current student on the programme to ask any questions that I had. Rachel also mentioned about there being placements in the course. So I'm just in my second year at the moment, so I've only had the 1 4-week placement. But I would just say it's such a valuable experience. OT and the way we can be involved in so many areas is amazing. And just being able to have a glimpse of what it looks like being an occupational therapist in different settings. It just really helps you to see how you can put the theory that you learn at uni into practice. And actually some of the second year modules that I'm doing now are looking at sort of the different settings that occupational therapists can work in on like stroke units or helping children with learning disabilities and across the lifespan of the human life. So it's really fascinating and great opportunity to be involved in such a variety of settings. And yeah, Rachel mentioned this earlier too, but I've really enjoyed having a smaller cohort. My psychology degree, I think there were 200 of us in a year group, so there was no way that I was going to get to know everyone on the course. But I think we've got 25. It's great to get to know them, know their names, hear a bit about their lives, and just share the student experience together. And then finally, I'll stop waffling soon, I promise. Finally, I just thought I'd share a couple of tips if they're helpful to anyone, and they're things that I found helpful in my time of applying. So the course is great, and so is studying, but it's important as well to have some time where you're enjoying other things that you like to do. Maybe that's meeting up with friends, or if you're staying on campus, you might be getting to know new friends or doing various sports or clubs. I would just say allow yourself time to enjoy those things. I try and treat the course a bit like a 9 till 5, like I did with my last job. So I'm trying not to study in the weekends and on the evenings and just keep my study during the day. And that has really helped me have a bit more of a like work-life balance. And I would just say come to the course with an open mind. If you're considering applying for the course, you may already know that you want to be a paediatric occupational therapist, and that may well be what you end up doing. But be prepared to be excited by something else. I really didn't think I'd like working in a hospital, but my placement was in a hospital and I actually really loved it. So I would just say come with an open mind to be surprised by what you might find interesting. That was a lot of information, but feel free in the Q&A later to ask me some questions. But otherwise, I'll hand over to Gregoria to share her experience too. Thanks, everyone.
Hi, everyone again. I'll share some slides with you too, which I've prepared. Hopefully everyone can see what I'm sharing. So hi everyone again, I'm Gregoria and I have just recently completed my degree this past summer. The BSc obviously in occupational therapy. So why I picked this course? So I was interested in healthcare in general. Like as a child as well, I actually was a school leaver to do this degree. So it was my first degree, and I was interested in healthcare and medicine, but I always had my doubts about medicine, so becoming a doctor. And when I heard about occupational therapy, I thought it sounded really amazing. I didn't really have the opportunity to actually know and like shadow to see what it actually is, because I'm also an international student, so I grew up in Cyprus. But it sounded really nice, and the people I spoke to and like the university tutors as well, which I had the chance to talk to, really inspired me, and I thought I'd take the risk. Why not? So I went for it, and I've not doubted once my decision to following this career. And I'm currently now doing a master's actually in neurorehabilitation, which, yeah, I'm enjoying at the moment. So, as the others have mentioned before as well, St George's is the UK's specialist health university, which is something very unique. Our campus at the moment is the hospital, St George's Hospital, and so, for example, when I would go to uni, I would walk through the hospital to get to the lecture rooms and to the uni part of St George's, which was very unique and very cool. We're also small cohorts, which is something that I really enjoyed too, as Lizzie said before. It's really nice to get to know everyone and also create a good relationship with your tutors as well, being able to ask them, and so like feeling confident to go and find them because you know them a bit better. It was really helpful for me throughout the course. We've also got a really good library, which is very useful and very good as you'd need good resources for your assignments, and in general, like a nice place to study as well. They've also got nice rooms that you can rent, you can book in advance to do like group work as well. And there's like silent study spaces, there's quiet study spaces. So it's, yeah, just really convenient and nice. There's also a canteen on campus and shops as well. And as Rachel mentioned as well, we'll usually go to uni like 3 to 4 times a week, and also have self-directed work throughout the week. So yeah, really good. In terms of societies and activities at St George's, so we automatically qualify for student union membership once you're a student there. There's an occupational therapy society, which I was part of. It restarted last year, so hopefully it's still going on and hopefully will thrive as well. There's an SU bar, student union bar, which hosts social events, but you could also go there to just have your lunch there with your friends. There's also a games room, a cafe, dance studio, music room, and several counselling and welfare rooms as well. In terms of societies, there's sports clubs, there's musical, drama and comedy, and other various societies, which I would, just really recommend you'd try them if you're choosing to be a student at St George's. As it's just a nice opportunity to meet more people and do activities that you're interested in, and not just uni work. There's a lot of places to go out to as well. Like I remember we used to go out for lunch sometimes when we had like an hour break. We'll go to a restaurant nearby, or we would go to a pub in the afternoon, like at the end of the semester, with like the whole uni cohort, because it's quite easy because it's quite small one, obviously. So yeah, there's pubs, there's a gym as well nearby if you're staying at the campus or near the different shops, Sainsbury's, etc. A tip would be for you to make sure you are taking care of your well-being, as obviously you are a student and you want to thrive in that area and study, but it's also very important to be well your own selves and do your extracurriculars and extra activities, so you're well to study and support others as well. I'd really recommend socializing and meeting unique individuals, as it's a great opportunity at St George's. I'd say try and have confidence. I know it might be difficult, especially at the start, but it's worth giving it a try. It's really important to do networking and create good relationships with people, and it's an opportunity as well, as you're quite close to your tutors and the other students. And it's also really nice that London is very diverse. So there's very unique people out there, and yeah, as Lizzie mentioned before, like mature students, school leavers, there's different like international students as well. So it's really nice to hear where they've come from and their experience in life and why they're choosing to do OT and where they're going as well. So you could either stay at student halls, which I heard is a really lovely opportunity and a great experience. It's nice as a student, like for me, it was the first time I moved out of home. So it was really, really nice to get to manage independently and live student life, university student life. So teaching Broadway would be a home away from home. And personally, what I did for the 3 years of the course, I commuted. So I stayed with friends and relatives outside in London, but not in Tooting. But it was like a really easy commute. There's the Tooting Broadway station. I think it's around a 10-minute walk, maybe a bit less as well, from the train station. So yeah, uni is really close to the train station. It's on the Northern Line as well. And placements in general can vary where they are, but I believe London transportation is quite easy to learn and quite easy to go with. So I didn't really have any difficulties like getting there on time. But yeah, it's quite important to have good time management and being organized in general to make sure that you're there on time. So living in London, I would say there's endless things to do and discover, which I really enjoyed. A lot of food, a lot of parks, musicals, theatre and more. And it's really great, like for me as well, I had the opportunity to travel a lot from London, which I really enjoyed. So again, I'll say it's really good to do things that you enjoy and have the opportunity to do as a student, which you wouldn't have the opportunity otherwise. So yeah, that was really a good experience for me. Another tip is taking care of yourself. So I'll say self-compassion is very important. So my father says this saying, which is self-care with no guilt. So taking care of yourself, obviously, is very important to then be able to do what you have to do in your daily routine and support other students, support and be an occupational therapist and be a student. So yeah, really important. Also, there is a lot of support for the students, as Rachel previously mentioned. During induction week, I think they'll usually tell you about what support is available. And also you've got your personal tutor, which it was like, from my experience as well, I'll go there and like send an email to my personal student and tell them, can we please meet because of this? And then we'll have like a quick meeting and yeah, have things sorted. I'll say setting boundaries when needed and getting personal support is really important. So you can have a balance to juggle both university and like your life in general. So what I really enjoyed, so placement was really nice, and yeah, teaching sessions and like doing group projects with all my peers was really nice. Getting to know the university professors quite well, making lifelong friendships. So I've finished uni this past August, but I'm still in touch with my friends and planning to meet. So yeah, just meeting very unique people. And yeah, just being a university student is something to enjoy. So yeah, thank you very much. Thank you for listening. And if you've got any questions, please ask.
Thank you so much to Gregoria and Lizzie. It's always really nice hearing our students' perspective as well. So yeah, thank you everyone. I've seen there's been some questions popping up, and Caitlin's been answering most of them, I think, as we've gone along. There was a couple there at the end that we didn't quite get to. I liked the one about, trying to choose between occupational therapy and physiotherapy. That's, I think you're probably not on your own there. I think, obviously, like Caitlin said, we're of course very, very biased to OT on this call. But something else that you might want to do is go and get some experience. So think about getting some work experience in both areas, reaching out to local hospitals, because lots of kind of big hospitals will have that structure in place where they offer work experience opportunities, and that might give you a little bit of a better idea of kind of where your interests lie. And then some questions about international placements that I thought I would answer. So Gregoria, I know you considered it, didn't you, in your final year? So how it works is that we offer it just for the final placement. So it's your kind of fourth placement, right? Sort of towards the end of your final year. There are some criteria that you have to meet in order to apply and be accepted for an international placement. And that's things around grades. So we want sort of to, I suppose, students who we know are going to cope with being on an international placement. So both academically and I suppose personally as well. So we do look at attendance grades, and we get you to write a statement explaining, why you think that you would be a good candidate to go in an international placement. Because obviously what we don't want is for students to be somewhere far, far away and for them not to be managing very well, and we're not there, we're not able to go there. Whereas, if students are struggling for any reason on placement in London, we can very easily go and visit if we need to, or meet with the student in person, and it's all a lot easier. So that's the kind of process. So we have just started offering international placements just before COVID, and then it all stopped for a little while. So it's only been back up and running for the last 2 years. So we had one student 2 years ago, so the year before you, Gregoria, who went to South Africa. And then last year, one of our students went to Bangladesh. And I know one of our students this year has asked and is very seriously considering going to that same placement in Bangladesh. So you need to find the placement yourself, and you do need to self-fund it, but there are some funding opportunities available to support you with that at the university. So is it competitive to get international placements? So yeah, hopefully I've answered that question and the example. So it's quite new. This course only started in 2017. And we had just kind of got to the point where we were able to offer international placements when COVID happened. So are there sports occupational therapists? Not really. I suppose that's not specifically a role that we work in. Sports is an occupation. It might be something that people come and ask us about. That might be someone's goal would be to get back to doing sports, but it's not a particular area or a kind of specific area that we would work in, no. A good question. Who wants to go?
I'm happy to chat a bit about one of mine. So I thought that the anatomy and that side of things would be quite tough. I was actually almost I probably wasn't as far along as you, but I was wondering about physiotherapy and occupational therapy, and actually decided to go down the occupational therapy route. And I'm very glad, but again, I'm a bit biased now. I'm on the course, but I knew that I always struggled a bit with like learning biological anatomy and terms like that. And you do still need to know that for occupational therapy. And we do have a module on that in first year, but physios will need to learn quite a bit more. But I was still quite nervous. So I would just give advice on just give yourself time. If you can, look over the lecture notes for the anatomy slides before the session, just so you've got a vague idea what's happening. Like Gregoria said, don't be afraid to ask questions. Everyone really wants to help you with your learning, and it's a great way to sort of consolidate what you've been learning and check if you've understood it yourself. And as Rachel said, there's really helpful anatomy practical sessions, so you can kind of see it in practice. So if you're more of a visual learner, there are also like videos available as well. So I would just, give yourself time if that's something you're nervous about. And there's a lot of support available if that is something you struggle with. But I would say that was mine.
For me, I would say I was a bit scared maybe about the transition of being like a student in a secondary school and then transitioning to university. But as we all said, like there's a lot of support, and I didn't once feel like it was whenever I needed support about like assignments as well, or had questions about them, which sometimes were quite challenging. There's like the Student Life Centre and various like online tools, but also people you could speak to guide you with your assignments if you're having difficulty with that. So yeah, even though it was quite scary at the start because it was a big change for me, it all went quite smoothly. So it's just you being able to and feeling confident to ask, send emails, go to your tutors, tell them if something's challenging you, and even like during placement as well, if you've had challenges or have challenges during placement, you could always contact your personal tutor and tell them, I'm struggling. How should we deal with this? Tell them what's going on, and they would always support you. So there isn't, I think, a challenge that you'd feel that it's too hard to overcome. So yeah.
Thank you, guys. We've had one. Are there any books that you would recommend as a good introduction to the world of OT? There's lots of books. Guys, I don't know if there's any one book that you kind of have felt was a good overview or a good starting point.
I am not sure I could think of a book off the top of my head, but I would say to check out the Royal College of Occupational Therapy website. They sort of have some really helpful pages which just break down what occupational therapists do, and what kind of areas they can be in. And I think they have some day in the life videos of what an OT might be involved in. So that's what I looked up before I came.
Yeah, they do. That's a really good recommendation. And the other thing I've just thought of actually, rather than kind of going down the route of sort of big, expensive books, is there's some podcasts. So the OT and Chill podcast is really good. Again, lots of different kind of podcasts about different experiences of people working in different clinical areas, different parts of the world, things like that. So that might give you a good snapshot and be a little bit more accessible than some of the big old heavy textbooks that we have. And then what are your best moments in occupational therapy? Gregoria, you're a bit further down the line. Do you want to start with that one?
Yeah. So best moments, I would say like placements were a big thing for me. So in general, like getting to see your profession in practice, so what you're going to be doing is really huge. And yeah, I believe occupational therapy is quite amazing in like what occupational therapists can do and how they can influence the life of a person. OTs out there are really inspiring as well. And yeah, just having that contact with patients and getting to see them improve, getting to see them go home if that's what they're aiming to do, or get to do activities that they couldn't do. Yeah, it could be emotional, but it's all worth it, and yeah, just really unique. So I think that's my peak my peak experiences will, yeah, placement experiences.
We've 3 minutes left. Did you have a highlight so far, Lizzie?
I would probably say placement as well, to be honest. Like Gregoria said, just putting it into practice and seeing what it looks like. And like the nature of many health conditions that we might be helping people with, they're not necessarily going to get better. And that can be quite sad and hard to be around, but actually we're here to help try and make their life as best as we can at this point in time. And so to be able to see like the rewards of helping this person to be able to do that, it's just so joyful. And they're no patient, well, I only did a 4-week patient, but patients are very appreciative because they know that you're trying to support them. And like Gregoria said, whether that's getting them home or just making their life a bit more enjoyable whilst they're here. So yeah, I would say placement is a big one.
Great, thank you guys. We are almost out of time and I don't see any more questions, so unless anyone has any final burning questions that they want to ask, I might draw it to a close on those lovely positive notes from you two. So yeah, thank you very much to everyone for attending this evening. We really hope that you have found this useful, and thank you so much to Gregoria and Lizzie, because I know that your insights and your views on your experiences here at St. George's are really what is valuable to our kind of prospective students. So thank you so much for giving up your time this evening, and I hope everyone did find that useful. Thanks, bye.
Thank you, bye.
Bye.